what exactly is referred pain? Referred pain basically means that you're feeling pain that travels down from a particular spot. So for example, you might have pain in your wrist, but it might be coming somewhere else like the forearm. So you might get symptoms that might be in one particular location, but the actual root of it is somewhere further away. So some of the sources of referred pain include muscles, nerves, fascia, and potentially it can also be organic in nature. So some common conditions that produce referred pain, very common is sciatica. The problem is actually situated in the back, but it can refer down the leg and into the heel. There's also carpal tunnel syndrome, where the problem is actually in the wrist, but you might get symptoms right in the hand. Also piriformis syndrome, which is kind of like sciatic-like symptoms, but it actually comes from your glute muscles. Potentially what could happen is that the person may be feeling pain. For example, we'll go back to the wrist and the hand. They might massage their hand, they might massage their wrist, but still feel that it's not going away. So it might be somewhere else higher up. So for example, near the elbow. Another common one is, a person feeling pain down the leg. They might say, well, my hamstring's really tight, my hamstring's really sore, or my heel's very sore. In actuality, it might be coming from the glute. They might find that when they press on a particular area in the glute, there is more referral pain down the leg. Basically, this is a trigger point chart. Trigger points are taut bands in a muscle that can refer to other areas of the body. They might actually mimic other symptoms medically. So here, you have a chart here, and it has these different colored points. And basically what that tells me is this is where a particular muscle might refer down. So for example, you see these little X's here, you might be able to see them. These X's tell me that these are points whereby if I were to press on them, they can refer down into particular areas. So that's basically what a trigger point is. The ideal thing to do for a patient that might be encountering referred pain is to obviously see a professional about it. Because regardless of what you do, you may not be able to find it on your own and figure out where the problem is actually rooted. So the quicker you go to somebody such as myself, a massage therapist, a physiotherapist, chiropractor, they'll help you a lot better in regards to figuring out where the source of the pain is. So examples of treatments that I've given that have had patients that have had referred pain, the jaw is one in particular. The muscles in the jaw actually can refer towards the face and head, give you headaches. It can also refer under the ear, give you a plugging sensation in the ear, maybe ringing in the ear. A very common one is like pain that goes down the arm. I'll treat the neck, and there's tightness in the neck muscles that can refer down the arm. It can press on some of the nerves that run down the arm via the neck and the shoulders. And when I release those areas, the symptoms tend to fade. So examples of treatments that I've given where a patient has shown referred pain. So patients have come in, for example, with headaches, maybe sinus issues, plugging in the ears, ringing in the ears, and it actually stems from one muscle. This muscle here, sternocleidomastoid. Usually what will happen is that the person will go to the doctor, and they'll be checked out as fine. They'll go to different specialists, they'll be checked out as fine. They come in here, and then I find that there's trigger points in the neck, in this muscle, sternocleidomastoid. It's one of my favorite treatments to do because it's a fascinating treatment. Once the muscle relaxes, lo and behold, the patient's symptoms fade. Yes, indeed. There's this new fascinating game that I've been seeing people, I will not name the game, but there's this new game where people walk around and search for things. It's like a modern day treasure hunt. Anyways, in regards to walking with your head down, in general, with maybe your phone, what'll happen is that potentially you can get headaches and neck pain. So those are some of the things that I could foresee happening when somebody has their head down constantly looking at their phones while they're walking. Mind you, there's other things that could potentially happen that are worse. You know, you could get injuries from getting hit by a car, maybe falling off a cliff, which I've heard somebody has done. So it's something to be aware of. If you're constantly doing something over and over again, whether you're in front of the computer or whether you're walking around with your head down looking for things, there is a potential for neck pain, headaches, shoulder pain, etc.